We recently introduced you to a cancer treatment called brachytherapy. It's not new, but it doesn't get a lot of commercial attention, so you may not have heard of it. But what is new is this, right here, a patient-friendly solution that uses brachytherapy to treat skin cancer. Here to tell us more this morning is Dr. Michael Kasper, radiation oncologist at Lynn Cancer Institute. Good morning, doctor.
Good morning.
Thank you so much for being here.
Thank you for having me.
Last time we did this segment and I was informed about brachytherapy. I'll be honest, I had not heard about it. Very interesting. Can you just recap a little bit about what brachytherapy is?
Yes, brachytherapy is a targeted type of radiation therapy. And as opposed to typical or more traditional radiation therapy, what most people are familiar with, brachytherapy delivers the treatment right inside the tumor or next to the tumor.
Wow.
So instead of these large machines which shoot down the radiation and the patient's lying on the table, brachytherapy uses a radioactive source where we actually place it in the tumor, or small machines place it right next to the tumor.
And there are many benefits to doing that as opposed to the other radiation therapies, correct?
That's correct. There are benefits of brachytherapy over traditional radiotherapy because we're sparing much more normal tissue because it's so close to the tumor. We can use much more effective, higher doses to treat the cancer. And when we're doing that, we can actually increase the amount of dose that we're giving each time, which lessens the time that we have to treat the patient. So for instance, for a typical treatment that may take 6 to 8 weeks of daily treatments with traditional radiotherapy, with brachytherapy, we can often do the same treatment in 1 to 2 weeks.
Wow, what a big difference, especially for someone who wants to just go on with their life on a day-to-day basis.
Correct.
What about side effects? Because I know there is a difference between the two as well.
Generally, the side effects are going to be much less with brachytherapy.
Excellent.
I mean, it has to be done carefully and with someone who's very experienced in delivering the treatment, but for the most part, side effects are much less.
That's awesome. We certainly are advancing, and especially with this right here. Let's talk about this now. This is called Estella?
This is Estella. This is an innovative new machine in treating skin cancer. It's innovative because it's mobile and is treating cancer without a radioactive source. So shielding is no longer a problem.
Really making a difference for patients that are being diagnosed today with skin cancer.
Absolutely.
All right, I want you to stay right there. I want to hear more about Estella. We'll be right back. We're going to talk more about Estella and about the advances in treating skin cancer with this machine right here. So stay right there. Welcome back, everyone. This morning we're talking about an innovative treatment for skin cancer that uses brachytherapy. Doctor, before the break, we introduced Estella. Before we get into the machine, let's talk about first skin cancer in general. You live in Florida. Yes. I live in Florida. Always been concerned about the sun, and my girls especially. I'm always trying to put as much protection on their face and body. And I don't care where you live in the country. You really got to be careful because it's prominent.
Absolutely. You're right to worry. Last year in this country, more people were diagnosed with skin cancer than breast cancer, prostate cancer, lung cancer. In fact, more people were diagnosed with skin cancer than all other cancers combined. And it's that outdoor lifestyle that so many of us love and enjoy, especially here in Florida, that is responsible for the rapid increase in skin cancers because it's sun exposure that causes skin cancer. So it's very, very important to use sunscreen, even more importantly, cover up and be very careful about exposure to the sun.
And that's something I try to tell my girls as well, because I always tell them this is one that we can avoid, or at least make every effort to avoid.
Prevention is key.
Now let's bring in now Estella and how brachytherapy and this machine are helping patients diagnosed with skin cancer.
Absolutely. This is Estella. This is an electronic brachytherapy machine that's quite innovative because it's treating skin cancers without a radioactive source.
Wow.
And because there's no radioactive source, shielding requirements are minimal. And that really expands where we can place this machine. Right now, fewer than half of the radiation centers in this country, I believe there's well over 2,000 in the country, less than half of them have brachytherapy. So with minimal shielding requirements, we believe that more centers will be able to bring in Estella and offer this to their patients.
Now walk me through how it works. Pretend, I'm a patient, I come in. How would you apply it? What would you do?
Well, typically in radiation therapy, people are walking into the department and they're going into a rather large, scary vault with a large machine. With Estea, they're walking into perhaps a smaller, softer room because it doesn't have to be as large with minimal shielding, and they're lying on a table or sitting in a chair, and we're going to move this machine right over to the portion of the body that needs to be treated, usually the face, limbs, or
so anywhere.
Body, anywhere in the body. So for instance, if we're treating a hand, we'll place the hand, immobilize the hand, and then move the machine right to the area to be treated.
And how long would that person be, I guess, standing there, and how many sessions would they be coming to?
The typical course of treatment is going to be 6 to 8 sessions, and each session could be as short as 1 to 2 minutes.
Wow, big difference from what many patients have encountered in the past.
That's correct. Many times, even skin cancer could be as long as 6 weeks of treatment,
wow.
Daily treatment.
And this is, I want to assume here, cutting edge technology, because I have a friend that was exposed to skin cancer, and she unfortunately got scarring on her face, so this obviously would help in that situation as well?
That's right. The cosmetic result is excellent with high-dose rate brachytherapy. There's no cutting or scarring. And
surgery?
There's no surgery involved. So people heal up very quickly and do quite well from the treatment.
You know, doctor, I'm always marveled at the advances that we encounter and what we're seeing day in and day out. Really big difference what Estea can do today.
Yes, we're quite excited about what it's going to bring to our clinic, and we think that it's going to bring this cutting-edge technology to more patients.
Now, if patients are interested and someone out there has been diagnosed with skin cancer, at the end of the day, always consult with your doctor?
Absolutely. It's best to speak with your physician, most importantly your dermatologist. We work very closely with our dermatologist. Unfortunately, most physicians, even some dermatologists, are not aware of what the modern radiation therapy department offers. So it may take some education on the part of the patient, but key is speaking to your doctor.
And thank you so much for educating us
welcome.
today. God bless you. Thank you, doctor. And if you'd like to learn more, just log on to our website, thebalancingact.com. We've got information about treating skin cancer and Estea. That's thebalancingact.com. We're also on Facebook and Twitter.